about Medicare. Medicare is a federal health insurance program, and one qualifies for Medicare if they are 65, have a certain disability, or have end-stage renal disease. You may be wondering why I chose this topic for my project, because it isn't a topic of interest for many people, including those in high school. But I'm hoping to major in healthcare management, or major in health science with a business focus in college, so I figured I would get a jump start on what I'm going to be learning now. When I was brainstorming what I should do for my project that involved Medicare, I thought about the vast majority of people that don't even know what Medicare is. Luckily, kids in high school and college don't need to start thinking about Medicare. However, numerous people who are close to qualifying for Medicare have no idea what it is. According to lifehealth.com, 60% of 64-year-olds know nothing or very little about Medicare, and only 11% know all or most of the information they need to know to enroll. This could cause people to choose a health insurance option that isn't best for them just because they didn't do their research. When thinking about this information, I decided to create something that would help people better understand what Medicare is and all the different options that one has when deciding what part to enroll in. Medicare is divided into 4 parts, Part A, B, C, and D, which can be very confusing. So what I decided to do for my project was to make 4 brochures outlining the 4 different parts of Medicare and put them in the Baker Free Library in White Rock Senior Living Community. Putting the brochures in those places is definitely a small step towards educating the public on Medicare. However, every little bit helps. For each brochure, I put important facts about the Medicare part, what it covered, and how much it costs. Now, you may be wondering why not many people are well educated on Medicare. It is because finding information on Medicare is extremely hard and the information is very confusing. I spent most of my time during the project trying to find information on the internet, watching videos, and reading books. I also completed a job shadow at a methadone clinic, and I job shadowed a key account manager for Johnson & Johnson. During both of my job shadows, I got to talk to people who actually worked in the healthcare industry, which was a very good insight for me. Each brochure looks simple, but it took a long time to try to analyze the information and put it into a small brochure. When referring to the cost of each part of Medicare, I will mention a premium, which is an amount to be paid to an insurance agency, and a deductible, which is a certain amount of money that a person must pay before an insurance company will start to pay for services. Here is the inside of the brochure that I created for Medicare Part A. Medicare Part A is also known as hospital coverage. It covers inpatient hospital care, skilled nursing facility care, and long-term care hospitals. It also covers nursing home care and hospital care. This part of Medicare is generally known as the cheapest part because one doesn't have to pay a monthly premium if they or their spouse have paid Medicare taxes for at least 10 years. If they paid Medicare taxes for at least 10 years, or for less than 10 years, they have to pay a certain amount per month depending on how long they paid taxes for. Here is a picture of the inside of the brochure that I created for Medicare Part B. Part B is known as medical coverage. It covers preventative services, which are services needed to prevent illnesses or detected at an early stage so it doesn't get worse, and medically necessary services. Services or supplies that are used to diagnose or treat one's medical condition. For Part B, one would pay a monthly premium. The average monthly premium for Part B in 2016 is $121.80. However, the cost depends on one's income. In 2016, the amount one would pay for their deductible is $166, and once it's met, they would pay 20% of the Medicare-approved amount for various services that they need. Here's the inside of my Part C brochure. Part C is also known as Medicare Advantage. Medicare Advantage is an option that one can enroll in instead of enrolling in original Medicare, which is Part A and Part B. Medicare Advantage plans are health insurance plans offered by private companies that are approved by Medicare. The plans have to cover everything that is covered by original Medicare besides hospice care. Medicare Advantage generally offers more coverage because it provides the same coverage as Part A, Part B, usually Part D, which I'll mention in a second, and also vision, dental, and hearing services. Part C monthly premiums range from $20 to $100. If one has Medicare Part C, they would pay a monthly premium on top of the Part B premium. Here's the inside of my Medicare Part D packet. Medicare Part D is also known as prescription drug coverage. There are various plans that one can choose from when enrolling in Part D. Each plan has its own list of drugs that it will cover. The monthly premium from Part D ranges from $10 to $200, and for a deductible, one would pay $360 out of pocket before Medicare would start to pay the cost of drugs. In the past week, I brought my brochures to the Baker Free Library in White Rock Senior Living Community. With this little steps, I will be able to educate Citizen and Bo on the different parts of Medicare and hopefully help them decide what parts they want to enroll in when the time comes. During this project, I set out with a goal to educate the public on Medicare, and in the process, I greatly educated myself. I wanted to make sure that I was an expert on what I would be discussing for my final talk, and I've taken a big step towards what I will hopefully be learning in the future. Throughout this project, I learned that a path in healthcare is what I want to take in the future. Taking this course in the summer was a challenge because I had to take the time to complete all of my assignments on time, even if I was on vacation. However, I learned that if I set my mind to something, I can accomplish it. I had to do excessive research for the project, and I learned that using various sources to find information was the best way to get accurate knowledge. I took the challenge of taking senior seminar over the summer, and I'm very glad I did. These brochures encompass the knowledge that I have about Medicare, and I hope to someday create an even bigger project that will educate people on various healthcare options that are available.